Welcome to episode 6 of my STI series. I'm sure most of you have heard of pap smear. Today, I'm going to educate you on that. And today's topic is going to be on human papilloma virus, HPV. HPV is one of the most important sexually transmitted infections you need to understand. HPV is not one virus, it's a group of viruses with which there are more than 100 types. It spreads mainly through skin-to-skin sexual contact, including vaginal, anal, and oral sex, even when there is no penetration or ejaculation. Most sexually active people will get HPV at some point in their lives, but in many cases, the immune system clears it naturally within 1 to 2 years without symptoms. The problem is that some types of HPV are low risk, while others are high risk. Low risk HPV types causes things like genital wax, which appears as soft, flesh-colored or cauliflower-like growths around the genital, anal, and sometimes the mouth. They may not be painful but can cause discomfort, itching, and emotional distress. While the high risk HPV are more dangerous because they can cause change changes in the cells over time, leading to cancer, especially cervical cancer, which is the most common type, but can also affect the anal, the perineal, the vaginal, and even the throat, and also leading to cancers in those areas. This virus works silently. A person can be infected for years without knowing why abnormal changes are slowly happening in the cervix. That is why HPV is often called a silent risk. In women, early changes can be detected through the pap smear and HPV DNA testing, which looks for abnormal cervical cells before they become cancerous. If detected early, these changes can be treated and cancer can be prevented completely. In advanced cases, persistent HPV infection can progress from mild cell change to precancerous lesions and eventually cervical cancer if not treated. There is no direct cure for the HPV virus itself, but we can treat the complications like genital warts and remove or manage abnormal cervical cells.